The country's largest not-for-profit health and aged care provider is putting its foot down.
I've basically said enough's enough, we've got to get this sorted, let's get our people vaccinated, let's mandate it and make sure everyone's in the same position.
And a national mandate's set to follow.
We'll provide some time, but it would only be a matter of weeks, I think.
But a mandate doesn't necessarily end the discussion. Just ask the state system. As of September 2, 16% of New South Wales health workers hadn't received their first shot ahead of the September 30 no jab, no work deadline. In aged care, 5.6% of workers nationwide are currently at risk of missing their deadline this Friday, leaving both sectors in a bind.
We do not have enough staff at this point in time, whether it be in ambulance service or generalised health settings, for the surge that we're currently seeing, let alone having staff not available to be working.
So what's the fix? Well, authorities are confident the ship will right itself.
Our health staff are seeing the consequences day in, day out of COVID infection. They're seeing patients in ICU, they're hearing the stories. I would be very surprised if we have much hesitancy in our healthcare workers.
But the New South Wales HSU is not leaving it to chance, offering jab-happy members the chance to win up to $1,000 through a vaccine lottery. They're also doing their best to allay any lingering concerns.
Education is the way forward. There are people who are concerned about being pregnant, so it's really important that we've been able to connect our people with the appropriate health professionals.
That message reinforced today.
I want to reassure everyone the vaccine does not increase the risk of miscarriage or structural abnormalities for your baby. It does not affect your fertility. What poses the greatest risk to women and their babies is not the vaccine, it is the COVID-19 infection itself.
So as an already stretched workforce prepares for the coming surge, will they be able to face it at full strength?
Well, Associate Professor Miriam Levy is chair of the Medical Staff Council at Liverpool Hospital, which has been hit hard by COVID, and she joins us now. Miriam, will this mandate work?
Yeah, well, I think it's the best shot. Obviously, deadlines is a very definitive strike to say what's acceptable and what's not acceptable, and giving a date with enough time. So I think it's working. The rates of vaccination at Liverpool Hospital, I don't know exactly, but I know that they've gone up a lot since there was a definite date, and some of the, obstacles are cleared away. But there are some barriers that I think we need to resolve to make sure it does work.
Well, I'm interested to hear what you think those barriers are, because it's perplexing why so many healthcare workers still aren't vaccinated. Why do you think that is?
Well, I mean, look, in reality, I suppose we have to think about why anyone gets vaccinated. And, I find that the narrative around vaccination for the general public is often about getting out of lockdown, whereas in fact, vaccination is about preventing us dying. When COVID first hit last year, we actually, my husband and I actually talked in bed about what happens if you die and what happens if I die and what happens if we both die. Like seriously, we were all really anxious. But I think that narrative around why we get vaccinated maybe hasn't got out to everyone. And healthcare workers is a broad community of people. Not all of them are necessarily at the front line. Not all of them are necessarily educated. Not all of them understand risk-benefit of a therapy like, a doctor or a nurse might. That it's a very broad church, the healthcare worker, and there's a lot of different people in it. But it's a privilege to be a healthcare worker. We're so lucky in Australia. And, I have no tolerance for anti-vaxxers who are also healthcare workers. I don't understand how you can work in an environment that rests all of its principles on evidence, and the evidence is clear for vaccination. I don't understand how you can turn up for work and believe all the evidence, support all the work, except vaccine. It's not acceptable to me.
Miriam, there'll be some people, health workers and just general public, who perhaps don't fully understand how serious COVID can be. We've actually got some pictures here. I wouldn't mind you helping us out with them, actually. So
Sure.
This is an X-ray of just lungs in a healthy person, I think. And the next one is the lungs of someone who has COVID. Can you explain to us, to me that just looks like stuff. Can you explain to us what that means?
Yeah, I will. I'll be happy to. So, look, what you can see when you do an X-ray is that the X-rays go straight through the lungs, and the dark is air. That's your normal lung, and the heart's in the middle, that big organ in the middle of white. A chest X-ray in COVID is a drowning person. And what you can see, all those blotches are pus and fluid pouring into the lungs. And actually, you know, that is,
Wow.
I imagine what drowning is like. And that's why people are gasping for breath. So, you know, the pneumonia of COVID can be absolutely catastrophic, and it's not about lockdown. People need to be vaccinated because the illness is terrible. And when you see those pictures, you can imagine why long COVID is a possibility. So it's not just about 90-year-olds dying and everybody else having a runny nose and lost their sense of smell. There's actually an in-between. Our wards are being turned over to become COVID wards to manage the numbers of people with COVID pneumonia. So, you know, it's a serious business, and it's hard to understand why people wouldn't get vaccinated for their own health, not just to go to the pub.
Well, if you're watching and you're in doubt, there's your reason to get vaccinated. Miriam, thank you for all the amazing work you do. We really appreciate your time tonight.
Thank you very much.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.